Hello, everyone, and welcome to our second module on the autonomic nervous system. In the first video on the autonomic nervous system, I showed the picture that's on this slide right now, and it depicts all the different organs and structures that are innervated by the parasympathetic and sympathetic branches of the autonomic nervous system. So what I'm going to do in this video is go through these organs and structures in detail and talk about exactly how the two different branches of the autonomic nervous system innervate various organs and structures, what neurotransmitters they use, and what receptors are involved. Let's start by talking about the skin, which, if you weren't aware, is the largest organ in the human body. And it's under sympathetic nervous system control. Importantly, it has no major parasympathetic innervation at all. When the sympathetic nervous system becomes active, one of the major things it does is vasoconstrict blood vessels that supply blood to the skin. What it does is activate alpha-1 receptors found on blood vessels in the skin, and that leads to vasoconstriction, and it decreases blood flow to the skin anytime the sympathetic nervous system is active. What this is going to do is make less blood go to the skin and save blood for vital organs like the brain and the heart. And so because of this, when the sympathetic nervous system is activated, the skin becomes cool to the touch. This is a classic sign of the fight or flight response. Besides making the skin cool to the touch, there are some other sympathetic nervous system effects related to the skin. First of all, the sympathetic nervous system can make a person break out in sweat. We'll talk about this in a minute, but you sweat when you're hot, but you also sweat anytime the sympathetic nervous system gets activated. And if that happens and you're not warm, this is called a cold sweat. And so breaking out in a cold sweat is a classic sign of sympathetic nervous system activation of sweat glands in the skin. The sympathetic nervous system can also affect erector pili muscles. These are small muscles that make your hair stand up, so it looks like this. Many people call this a development of goosebumps, and this is another sign of sympathetic nervous system activation, part of the fight or flight response. Now, as you're probably aware, if you've ever been outside on a hot day, when your body temperature rises, you will sweat, and this is called a hot sweat. This is also mediated through the sympathetic nervous system, so let's talk about how this happens now. So blood flow to the skin and sweat are also affected by heat. When the body temperature rises, like when you go outside on a hot day, that increased temperature of the body will be sensed by the hypothalamus. And in other videos, I talk about the hypothalamus in detail and which nuclei of the hypothalamus control body temperature. But anytime the hypothalamus detects a rise in body temperature, it will increase blood flow to the skin in order to dissipate heat. And so this is why when you go outside on a hot day, your skin can become flushed. You have more blood flow to the skin. That's driven by the hypothalamus trying to dissipate heat. But the hypothalamus will also trigger sweat, and that's because the evaporation of water takes heat with it. So evaporation of sweat dissipates heat, in addition to having more blood flow to the skin. Well, the way you sweat when you go outside on a hot day is that the hypothalamus uses sympathetic nervous system fibers to activate muscarinic cholinergic receptors, M3 receptors found on sweat glands. And that's how you sweat when you go outside on a hot day. And you should be aware that in pathologic states where the skin is unable to generate sweat, the skin will become red and flushed because the body will maximize blood flow to try and dissipate heat, since it can't dissipate heat through sweating. So two of the classic situations where this occurs are, first of all, in anticholinergic poisoning. One of the clinical features of this is that the patient becomes red as a beet. And that's because anticholinergic poisons block these M3 receptors, so you can't sweat, and therefore the skin gets red and flushed. Also in patients who have Horner syndrome, which is where they lose sympathetic nervous system innervation to the face, they will develop anhidrosis. This means they can't sweat on half of the face. And that half of the face is going to become very red because the skin is going to become flushed to try and dissipate heat, since it can't dissipate heat through sweating. So a couple of examples of clinical situations where autonomic innervation of the skin is important. First of all, heart failure or hemorrhage. Both of these conditions lead to massive activation of the sympathetic nervous system. That's going to trigger alpha-1 receptors in blood vessels to the skin, and that's going to cause the skin to become cold. So a classic sign in a person who is hypovolemic from hemorrhage or a person with advanced heart failure is to have very cold skin, and that's evidence of activation of the sympathetic nervous system. Also, when patients have sepsis and septic shock, they have massive sympathetic nervous system activation. However, sepsis causes vasodilation from inflammation and cytokines. It also causes fever from infection, which the hypothalamus controls. So the result is that the skin is going to become very warm in patients who have sepsis, even though the sympathetic nervous system is active. And that's because there's something additional going on in this setting. You have high temperature from inflammation, and you have vasodilation from sepsis. And that's why you get warm skin and sweating in sepsis, whereas you have cold skin and sweating and heart failure or hemorrhage. Okay, moving on from the skin, let's talk about the lungs. So the lungs have both sympathetic and parasympathetic nervous system innervation. When the sympathetic nervous system becomes activated, you will see bronchodilation in the lungs. So the bronchioles are small airways in the lungs that contain smooth muscle. And those smooth muscle fibers have beta 2 receptors. And when they're activated by the sympathetic nervous system, that leads to smooth muscle relaxation and bronchodilation so that more airflow can go in and out of the lungs. These beta 2 receptors can be activated by norepinephrine from nerve endings, but they're very sensitive to epinephrine, even more so than norepinephrine. And epinephrine is released from the adrenal gland when the sympathetic nervous system activates. And so that circulating epinephrine in the bloodstream binds beta 2 receptors in the lungs, and that's a major way you get bronchodilation when the sympathetic nervous system activates. In contrast, the parasympathetic nervous system, when it's active, this activates muscarinic M3 receptors on smooth muscle cells. This leads to bronchoconstriction. And so a classic example of this is organophosphate poisoning, which I talk about in other videos. When this happens, you have excess acetylcholine released by the parasympathetic nervous system. This is going to lead to excess activation of these M3 receptors, and that's why patients who have organophosphate poisoning develop bronchoconstriction, wheezing, and this can potentially be a cause of death from respiratory failure. So shown on this slide are some examples of where autonomic function in the lungs are clinically relevant, and one of the big ones is wheezing. So there are many pathologic states where patients develop wheezing, which is caused by constriction of the bronchioles. This can happen in patients having anaphylactic reactions. It happens in asthma. And one of the ways you can treat wheezing is by activating the sympathetic nervous system to cause bronchodilation. So for example, albuterol is a beta receptor agonist, and it activates beta 2 receptors in the lungs, causing bronchodilation. Epinephrine, as we just talked about, is a powerful activator of beta 2 receptors. It also causes bronchodilation to treat wheezing. And then ipratropium is a muscarinic antagonist. It can be used for asthma and other lung conditions. It blocks those muscarinic receptors that are part of the parasympathetic system. So remember, the parasympathetic system causes bronchoconstriction. So by blocking it, you get relative bronchodilation, and that's how muscarinic antagonists help in breathing problems. Methacholine is a muscarinic agonist. It's sometimes used for the diagnosis of asthma. Patients who have asthma are more sensitive to methacholine, and they will develop more rapid bronchoconstriction at lower dosages compared to patients who don't have asthma. Okay, next let's talk about the heart, which is an organ that is completely under autonomic control. You cannot voluntarily tell your heart to contract or relax. It's not under your voluntary nervous system control. And there are three elements of heart function that can be influenced by the autonomic nervous system. The first one is the heart rate. The heart rate is determined by the SA node, but the SA node can speed up or slow down under influence of the autonomic nervous system. The second element of the heart that is under autonomic control is contractility of myocytes in the atria and ventricles. These myocytes can contract more vigorously or less vigorously under the influence of the autonomic nervous system. And then finally, conduction velocity, meaning the speed by which electrical impulses travel through the AV node and the His-Purkinje system. This also can be sped up or slowed down by the autonomic nervous system. For the sympathetic nervous system, when it wants to influence these things here, it activates beta 1 receptors. That's what you find in the heart. And the activation of beta 1 receptors can increase the heart rate by increasing the rate of SA node firing. It can increase ventricular contractility by activating myocytes, and it can increase the conduction velocity through the AV node and His-Purkinje system. In contrast, the parasympathetic nervous system uses M2 receptors, which are innervated by branches of the vagus nerve, to affect these three things right here. Parasympathetic system through M2 receptors can decrease the heart rate. It can also decrease contractility, although mostly just in the atria. There aren't a lot of M2 receptors on ventricular myocytes. And then finally, conduction velocity can be slowed down by M2 receptors in the AV node. Shown on this slide are a few selected clinical examples of where autonomic innervation of the heart is clinically relevant. The first one is with inotrope drugs like dobutamine. So dobutamine is a beta agonist, and so it's going to activate those beta 1 receptors in the heart. This is going to increase the heart rate and contractility, and these drugs are used in advanced heart failure. Beta blockers, in contrast, block those beta 1 receptors in the heart, so they slow heart rate and they decrease contractility. And these drugs have many uses that I talk about in other videos. They're used to treat hypertension, they're used to treat tachycardia, and many other things. And then atropine is a drug that's a muscarinic blocker, so it's going to block those M2 receptors in the heart and block the effects of the parasympathetic nervous system. This is going to increase the heart rate, and this is sometimes used in patients who have bradycardia and cardiac arrest to try and speed up the heart rate. Okay, next let's talk about the kidneys. So the major autonomic innervation to the kidneys is via the sympathetic nervous system. It can activate beta-1 receptors in the kidneys, and when it does this, renin will be released, and this activates the renin-angiotensin-aldosterone system, which I talk about a lot in other videos. There are also alpha receptors found on smooth muscle fibers of the afferent and efferent arterioles in the kidneys. So when these alpha receptors are activated by the sympathetic nervous system, this will cause constriction and decrease blood flow generally to the kidneys. And the idea here is that you want to decrease blood flow to the kidneys when the sympathetic system is activated so that the GFR goes down and you're filtering less water and other substances. And this is going to limit sodium and water excretion. So one of the goals of the sympathetic nervous system when it's activated is to retain sodium and water as part of that fight or flight response. And that's the net result of activation of the kidneys by the sympathetic system, is to increase sodium and water retention. And the major example of where this is relevant clinically is in patients with heart failure. They have chronic activation of the sympathetic nervous system, and that's one of the reasons that they retain sodium and water, and that's why swollen ankles and fluid in the lungs are hallmarks of congestive heart failure. Okay, next let's talk about the gastrointestinal tract. So the gastrointestinal tract is innervated by the sympathetic nervous system, and this system can activate alpha-1 receptors on smooth muscle fibers. These are found on blood vessels, so when the sympathetic nervous system activates these alpha-1 receptors, you get vasoconstriction of arterioles and a decrease in GI blood flow. One of the major things that occurs anytime the sympathetic nervous system is active is you get less blood flow to the skin and to the GI tract, and that's to preserve blood flow for vital organs like the heart and the brain. The sympathetic system can also slow transit and motility through the GI tract by constricting smooth muscle fibers that are part of sphincters in the GI system. The parasympathetic system also innervates the GI tract, and when it's active, this will increase motility by causing the relaxation of sphincters. And that's why the parasympathetic system is called the rest and digest system, because anytime you're digesting food, this system is active and there's lots of motility in the GI tract. So some of the places where this is clinically important are, first of all, with anticholinergic drugs. Any drug that has anticholinergic properties is going to block the parasympathetic system from increasing motility, and that can lead to constipation. In contrast, in clinical situations where there's cholinergic excess and lots of acetylcholine and lots of parasympathetic nervous system activity, that's where patients can get diarrhea. And that's why diarrhea and loose stools is one of the features of organophosphate poisoning, where you get an excess of parasympathetic cholinergic activity. Okay, next let's talk about the salivary glands. So the salivary glands are funny in that they have innervation by both the sympathetic nervous system and the parasympathetic nervous system, and both of these systems can increase saliva production, but the type of saliva you make is different. So when the sympathetic nervous system is active, you make thick saliva. When the parasympathetic nervous system is active, you make watery saliva. So sometimes patients, when they're very frightened and they have a sympathetic response, they can develop a sticky mouth. That's that thick saliva. In contrast, when you're about to eat food, you make that watery saliva. That's from the parasympathetic system. And in general, the parasympathetic system, its control of salivary glands is what dominates. This can be activated by the smell of food or the sight of food. Parasympathetic fibers will release acetylcholine onto M3 receptors, and this will cause the production of watery saliva, which helps with digestion. And one of the places this is clinically important has to do with anticholinergic drugs. Any drugs that block muscarinic receptors will cause dry mouth, and that's because they block the ability of the parasympathetic nervous system to drive saliva production. Okay, next let's talk about blood vessels. So two of the major blood vessel types that are innervated by the sympathetic nervous system are the arterioles and the veins. So the arterioles are blood vessels that deliver blood to the skin, the GI tract, the kidneys, and the degree of constriction or relaxation of these vessels is what determines the overall resistance of the vascular system. Importantly, the amount of constriction of your arterioles is what determines your systemic vascular resistance, which is a very important cardiovascular physiology parameter. And so the arterioles contract when alpha-1 receptors on arterioles are stimulated by the sympathetic nervous system. And this is one of the ways that the sympathetic system raises your systemic vascular resistance. The sympathetic system can also constrict veins, and when it does this, it will push blood out of the veins and send it back to the heart. And this is going to increase the preload to the left ventricle. This is also mediated by alpha-1 stimulation. So putting this all together, anytime your sympathetic nervous system is activated, you're going to get constriction of arterioles to raise the vascular resistance, and you're going to get constriction of veins to force blood back to the heart, and all of this is mediated by alpha-1 receptors. Okay, next let's talk about the eye. So many elements of the function of the eye are under the control of the autonomic nervous system. First of all, let's talk about pupil diameter. So the sympathetic nervous system can activate alpha 1 receptors found on smooth muscle fibers of the iris, and this will increase the pupillary diameter. This dilates the pupil, it causes mydriasis. In contrast, the parasympathetic nervous system can activate M3 receptors found on smooth muscle cells in the iris, and this will decrease the diameter of the pupil. This constricts the pupil, it causes miosis. And the idea here is that part of the fight or flight response when the sympathetic nervous system is active is you want the eye to dilate to allow more light in and to improve vision. Parasympathetic nervous system does the opposite. And then accommodation refers to altering the shape of the lens of the eye to focus on near objects. This is caused by contraction of the ciliary muscle, and this is mostly under parasympathetic nervous system control. There are M3 receptors found on the ciliary muscle, and they cause it to constrict so that you can look at near objects. And so because of this, any drug that has muscarinic blockade type effects will lead to blurry vision. This is called cycloplegia. You won't be able to contract the ciliary muscle and you won't be able to focus on near objects, and that will cause them to be blurry. And as I mentioned, the overall sympathetic nervous system effect on the pupil is to allow more light in, to allow more far vision, and this is all part of the fight or flight response. The way that the parasympathetic and sympathetic nervous systems control pupillary diameter is illustrated on this slide. So what the parasympathetic system does is it causes contraction of the sphincter pupillae. That's this muscle here in the center. It surrounds the pupil, and when it constricts, pupil gets smaller, and that's how the parasympathetic system shrinks the pupil. In contrast, the sympathetic nervous system can cause the dilator pupillae muscle to contract. That's this muscle that's shown on the outer section here with the arrows pointing outwards. And so when it contracts, it sort of pulls the iris outward in this direction, and that causes the pupillary diameter to increase. And then the autonomic nervous system also plays an important role in the production of aqueous humor, which is a fluid found in the anterior chamber of the eye that I talk about in a lot of detail in videos in the ophthalmology section. But this fluid allows the eye to focus as part of the fight or flight response. And so if you know this, then it's easy to remember that the sympathetic nervous system increases the production of this fluid by activating beta 2 receptors found in the eye. This is going to raise the intraocular pressure in the anterior chamber. Parasympathetic nervous system does the opposite. It contracts the ciliary muscle, which is a muscle found in the eye, and this causes fluid to drain from the anterior chamber. This reduces the amount of aqueous humor in the eye and lowers the intraocular pressure. And these effects are important when talking about glaucoma, which I talk about in other videos. It's a condition associated with high intraocular pressure, and it's treated by manipulating the sympathetic and parasympathetic nervous systems. And so that's a nice segue into some clinical examples of where autonomic innervation of the eye is important. And a big one is glaucoma, which, as I mentioned, refers to increased intraocular pressure in the anterior chamber of the eye. So the treatment of this condition often involves reducing the amount of aqueous humor in the eye. There are two ways you can do this. One is to use drugs that are agonists to muscarinic receptors. These drugs are going to activate the parasympathetic nervous system in the eye and reduce the amount of aqueous humor, and that's going to treat glaucoma. So that's how drugs like carbachol and pilocarpine work. You also can reduce aqueous humor with beta blockers that block those beta 2 receptors so less aqueous humor is produced, and this is how timolol eye drops work. And then pupillary dilation, if you think about that, anything that activates the sympathetic nervous system is going to cause the pupils to dilate. So this is a classic feature of cocaine intoxication. Patients who use cocaine have massive activation of the sympathetic nervous system, and they will present with dilated pupils. You also can get dilated pupils anytime you block the parasympathetic nervous system. So for example, there's a drug called tropicanamide. It's an antimuscarinic drug. It's going to block the parasympathetic nervous system, and that also will lead to dilated pupils. Okay, our next organ is the uterus, which is an organ composed of smooth muscle fibers, and those smooth muscle fibers contain lots of beta 2 receptors. When they're activated, this causes relaxation of the uterus. The place where this is important is in women who develop preterm labor, which is contraction of the uterus before the water is broken and before the baby is ready to be born. Those women can be treated with terbutaline, which is a beta 2 agonist. It's going to activate these receptors. It's going to cause the uterine smooth muscle to stop contracting and to relax. And then there are also alpha receptors on the smooth muscle fibers in the uterus, and these are important at the time of delivery. So when delivering a baby, the sympathetic nervous system gets activated, and that's one of the things it does is stimulate these alpha receptors to tell the uterus to begin contracting to deliver the baby. Okay, next let's talk about the bladder, which can be a confusing organ because it's under the control of the sympathetic nervous system, the parasympathetic system, and it's also under somatic or voluntary control. So to understand this, you have to appreciate that there are three muscles that control our ability to urinate. The first is the detrusor muscle. This is smooth muscle within the bladder itself, and it's completely under autonomic control. And then the urethra, which is the pathway that urine goes through to exit the body, has two sphincters. The first one is the internal sphincter, located near the base of the bladder. This has smooth muscle fibers and it's under autonomic control. And then the second sphincter is the external urethral sphincter. It's under voluntary control. It contains skeletal muscle. And so if you look at this drawing on the slide here, this is the detrusor muscle. It's smooth muscle that surrounds the entire bladder. Then this is the urethra here. It's got one sphincter up at the top. That's the internal one, and another one down at the bottom. That's the external one. And here's another image just showing the same thing. The detrusor muscle is the major smooth muscle of the bladder itself. And then the internal sphincter is located at the base of the bladder. And then not shown in this slide is the external sphincter under skeletal muscle or somatic control further down. So now let's talk about what happens to those three muscular structures of the bladder when the bladder is filling. In other words, when you're not attempting to urinate. In this setting, the sympathetic nervous system dominates. What it's going to do is stimulate beta-3 receptors on the detrusor muscle to tell that muscle to relax so that the bladder can fill. The sympathetic system is also going to activate alpha-1 receptors on smooth muscle fibers of the internal urethral sphincter so that it stays contracted so that urine can't spill into the urethra. And then finally, when your bladder is filling, you voluntarily maintain contraction of the external urethral sphincter once again so that urine can't pass out of the bladder. In contrast, micturition is the process of expelling urine from the bladder, and in this setting, the parasympathetic nervous system dominates. That system will activate M3 receptors on the detrusor muscle to tell the bladder to contract. This is going to force urine out of the bladder. The parasympathetic system also activates M3 receptors on the internal urethral sphincter so that it will relax and allow urine to flow into the urethra. And then finally, under voluntary control, when you want to urinate, you relax the external urethral sphincter, and this allows urine to pass out of the bladder and out of the body. So here's a summary slide to help you keep these things straight in your mind. When the bladder is filling, sympathetic control dominates. The detrusor muscle is relaxed so the bladder can expand. The internal urethral sphincter is contracted so that urine can't flow into the urethra, and the external sphincter is also contracted. In contrast, when you're urinating, the process of micturition, this is under parasympathetic control. The detrusor muscle of the bladder contracts to expel urine from the bladder. The internal urethral sphincter relaxes so that urine can flow into the urethra. And then under somatic control, the external sphincter also relaxes. So shown on this slide are some clinical examples of where autonomic innervation of the bladder is relevant. A big one is with drugs that have anticholinergic properties and can block muscarinic receptors. Drugs that have these properties inhibit urination, and they can make people unable to urinate, especially older men. Older men often have enlarged prostates, so they need to vigorously contract the detrusor muscle to urinate. And so if you block some of that ability to contract the detrusor muscle, these men can find that they are unable to void and they will present with inability to urinate and pelvic fullness from a distended bladder. There are many drugs that have anticholinergic properties, but the classic drug is atropine. If you ever give atropine to an older man, you can almost be guaranteed that a day later he will complain of pelvic fullness and be unable to urinate. And then these three drugs here I talk about in other videos, but all of these drugs are anticholinergics that oppose muscarinic activity at the detrusor muscle, and they can be used to treat overactive bladder and incontinence. So some forms of incontinence are caused by the detrusor muscle contracting too vigorously or spontaneously when a person isn't in the bathroom, and this will cause them to lose urine. This is called incontinence. And so these drugs, by blocking M3 receptors, keep the detrusor muscle relaxed and they keep it from contracting, and they can treat certain forms of incontinence. And as I said, I talk about these drugs in detail in other videos, but you should be aware that some of their side effects come from blocking muscarinic receptors in other locations. For example, some of these drugs can cause constipation. They can also cause dry mouth, and hopefully this makes sense to you now. This is from blocking muscarinic receptors in the GI tract and the salivary glands when you're trying to just block muscarinic receptors in the bladder. Metabolism is also affected by the autonomic nervous system. This is a huge topic that I won't go into a lot of detail here. I discuss this a lot in the biochemistry section, but you should be aware that the sympathetic nervous system can alter glucose and lipid levels in the blood by altering the metabolism of those substances. One of the major things sympathetic activation does is raise serum glucose. This is part of the fight or flight response. It does this through multiple different effects on liver cells and the pancreas. It can affect hormone levels like insulin and glucagon. But all these things lead to more glycogenolysis, which is breakdown of glycogen, and more gluconeogenesis from the liver. And so both of these things raise serum glucose. The sympathetic nervous system also converts triglycerides into free fatty acids so that they're available for fuel. This is a process called lipolysis. And the idea behind both of these effects is basically to have more glucose and more free fatty acids available throughout the body for fuel as part of the fight or flight response. And one of the ways I've always remembered what the sympathetic nervous system does in terms of metabolism is to remember that epinephrine, a major hormone of the sympathetic nervous system, is considered an anti-insulin hormone. And it's considered this because it opposes the effects of insulin. And so if you know that insulin tends to lower glucose levels, then you can remember that epinephrine and the sympathetic nervous system tend to raise glucose levels. It does this through a number of ways. Epinephrine decreases insulin release from the pancreas by activating alpha-2 receptors. It also decreases the synthesis of glycogen, and it increases the breakdown of glycogen via beta-2 receptors in liver cells. And so this is going to boost serum glucose. And then epinephrine also decreases the storage of fatty acids in adipose tissue, and this is going to increase the amount of free fatty acids in the serum. Okay, next let's talk about male sexual function. Both the parasympathetic and sympathetic systems play a role in male sexual function. First of all, the parasympathetic system innervates the penis using nerve fibers that come from pelvic splanchnic nerves that arise from the S2 to S4 level. These nerves innervate endothelial cells in the penis, which have M3 receptors. And when these receptors are activated, the endothelial cells produce nitric oxide. Nitric oxide then diffuses to smooth muscle cells and causes production of cyclic GMP, and that in turn causes smooth muscle relaxation. And this is how you get more blood flow to the penis through the parasympathetic system. And when the corpora of the penis swells, that's what leads to development of an erection. And so a key point here is that the parasympathetic system causes smooth muscle relaxation indirectly. The M3 receptors are found on endothelial cells. They produce nitric oxide, and the nitric oxide is what leads to relaxation of smooth muscle fibers. Now, the sympathetic system also plays a role in male sexual function. It sends fibers via the hypogastric nerve, which comes from T11 to L2, and these fibers are required for ejaculation and detumescence, which is resolution of an erection. And so the mnemonic that many medical students have used for years and years to remember this stuff is point and shoot. So point has a P in it. That's for the parasympathetic system, and that's what you need to develop an erection. Shoot has an S in it. That's for the sympathetic system, and that's what you need for ejaculation and detumescence. And so some of the ways that autonomic nervous function in the penis are relevant in terms of male sexual function are shown in this slide. First of all, the treatment of erectile dysfunction often involves drugs like sildenafil, which you may know by its trade name Viagra. These drugs relax smooth muscle in the penis so that an erection can occur. The way these drugs work is they block the breakdown of cyclic GMP. As I told you on the last slide, nitric oxide drives the synthesis of cyclic GMP to cause smooth muscle relaxation. And so if you block the breakdown, you get more cyclic GMP, more smooth muscle relaxation, and more blood flow to the penis to achieve an erection. And then SSRIs are antidepressant drugs, and one of their common side effects is anorgasmia. Many patients who take these drugs are unable to develop an orgasm. And the reason for this is because these drugs blunt the central sympathetic nervous system function, so you get less sympathetic outflow to the penis, and that's how anorgasmia can occur. And then I'll finish with one slide on cold temperature or hypothermia, which can activate the sympathetic nervous system, which in turn will try to raise the body temperature to help us survive in a fight or flight response. One of the ways the sympathetic system does this is by stimulating beta-3 receptors, which are found in specialized fat cells called brown fat. This type of fatty tissue can generate heat. It can create thermogenesis. The way it does this is basically it carries out oxidative phosphorylation, the process by which our cells make ATP, but it doesn't make ATP. Instead, it just wastes that energy and turns it into heat. And this tries to raise the body temperature to protect us from severe hypothermia. The sympathetic system can also stimulate alpha-1 receptors in the skin. This is going to cause vasoconstriction and divert blood away from the skin, which preserves heat by keeping the blood inside our body and not allowing it to get near the surface where that heat can be lost. And then finally, another survival mechanism in the setting of hypothermia is shivering, which refers to muscle contractions to generate heat. This actually isn't controlled by the sympathetic nervous system. This is triggered by the hypothalamus. It can directly activate motor neurons, and that causes us to shiver. And that concludes our second module on the autonomic nervous system.